Yeah, I'm Rod Mountain. I'm a head and neck surgeon, so I mainly deal with cancer, but we deal with a wide range of all the other normal ENT aspects of care, and we do a lot of training. So training is a big focus of some of the creative new technology links that we're trying to form in Dundee. It's one of our big strengths. There's one key word that just comes through all the time, and it's communication, connection, people working together, a far more collaborative approach to challenges, where previously we used to just, the healthcare guys used to use a very science-based approach to try and solve problems. In other words, drugs trying to solve medical problems, operations trying to solve medical problems. We suddenly realized, that's not working, and we've got to look at a different way of approaching this, and this is where the creative sector come in. You can put an object in 3 dimensions in space, and that just led to lots of ideas. We can use this for teaching, we can use it for training our surgeons how to do operations, but more importantly in the future we could maybe use it for actually planning real-life operations. So we could take your scan, put it in 3D space with a team of doctors and healthcare workers having to come to a solution and plan your operation and your care around that. So that personalizing stuff through augmented reality in a real clinical setting, it's going to come. I mean, we've been very lucky in Dundee. We've partnered up with a big multinational company called Medtronic, and we have an academic health science partnership in Dundee which is pretty unique. It's the university and the NHS working together, and this has attracted a really big company to come and look at what we do, our strengths, particularly in education, skills training, all these sort of things. They've seen that it's one of these Dundee strengths. They were so impressed that they now invested even more money in a big summer project that is running as we speak, and they were looking at one particular bit of anatomy. And if this works, it can be applied for a whole lot of medical things. And that's where I think augmented reality is going to work, because you can get an object and you can almost peel off layers and go deeper in and learn that 3-dimensional anatomy. I think AR actually in theatre, when you're doing an operation, would be brilliant. If you can overlay your radiology, in other words, your scans that you've had done. So if I'm doing an operation on you, I'm looking at you. I have your CT scans or your MRI scans, that data's there, but it's quite often on a screen in a different part of the room without having to look at that and, just remind myself what's wrong and where I need to go. If you can actually overlay that radiological imagery in real time right in front of where I'm operating, fantastic. And the audio input I think is really important as well. It's not just visual, it's audio as well. So you could be guided by somebody else in another room, in another country, or looking at the same image, but getting help and advice coming through the audio link in the HoloLens. It's going to be mind-blowing. It's going to be really good.